Well, we're gravely concerned to hear that 74 members of staff from the care agency out of 303 have resigned over the last 2 years, which we feel is unprecedented, especially for a Gibraltar public sector entity, where the Gibraltar public sector jobs are about security, stability, and we've actually consulted with human resources specialists for Gibraltar, and they claim that anything over 0 to about 3 or 4% raises concerns, and to us it indicates a low level of morale and extraordinary instability. And obviously what we are very concerned about is how this impacts heavily on the most vulnerable people in our community, especially looked after children who need a team of workers who are familiar. They need that stability, the continuity of care, security, rather than this high turnover of staff that are going through the agency.
Well, you're speculating that morale is low. The truth is it must be a very difficult environment in which to work.
We're talking about the loss of 25% of the staff over 2 years. They may not be the most glamorous type of jobs, but even still, these are public sector jobs where people are voluntarily resigning from. And in fact, these figures are backed up by the concerns that we've been getting from a lot of staff members, ex-staff members, people who work in the third sector, voluntary charity sector, who perhaps support social services, family members, other agencies, where they're actually hearing of the challenges that the agency is facing, and they are very concerned about the vulnerable people we should be looking after, and especially the most vulnerable, who are the children.
Okay, what do you think the government should do?
We think it's important that the government actually action their manifesto commitment, which is to an independent review. At the moment they're conducting an internal review, but we don't feel that has successfully addressed the challenges perhaps they are facing, so we would like them to conduct an independent review.
In Sacramento, what's your take on the numbers that you provided Parliament with on Friday? It does look like a lot of care agency staff have resigned in the past 2 years.
What we need to do is place a written answer in context. First of all, what that written answer says is that 74 out of a total of 610 staff have resigned. Now that is actually 12% of the workforce of the care agency and not 25%, as the opposition is alluding. Out of the number of 74, in fact 42 are care workers, and of those 42, 15 are care workers who work in the children's department, in the children and families section. And this is a number that represents people who have resigned over the space of 2.5 years. In fact, out of those 15, there are 2 who've actually retired, but have come back on a supply basis. So they were in the way that the answer was answered. We had different sections, and they were in the resigned section and not in the retired section. So really, what we're talking about is 13 people in the children and families team in the space of 2.5 years. If I can compare that to 2010, for example, there were 15 resignations, and that is a time when the GSD were in charge. So I'm sure that the opposition are now very concerned, or expressed to be very concerned about the high turnover of staff, but I'd just like to remind them that the staff turnover in 2010, for example, was much, much higher in that section than it is now.
Let's take your figure of 12%. Does it indicate that morale is low?
Most of the jobs throughout the care agency entail frontline work, and work that is very demanding and work that is very stressful. So across the board in this industry, not only in Gibraltar but everywhere, it is a line of work that generally and traditionally has a high turnover of staff. In terms of social workers, again, it's been very, very difficult historically to recruit social workers because locally people haven't trained to be social workers. in order to redress that now, what we're doing is that we have a training scheme for graduates returning from university, and we have a specific scheme for them, which means that they shadow social workers, they rotate between different departments, and that they gain the relevant experience in order to be able to apply for the jobs for social workers when these become available. So we are now forward planning in terms of social services.
Well, are your staff unhappy?
What I need to say is that morale was at breaking point when we came into administration 2.5 years ago, because of the problems that we inherited of the way that social services was run by the GSD administration. So morale has been low for a while. I don't believe that morale is as low now as it used to be. But I recognize that this is a department that has very serious problems. I do not have a magic wand. I cannot fix everything overnight, but we are working very, very hard in all the departments of the care agency to review them and to fix. What we have to do is we have to fix what the GSD had 16 years to destroy.
You promised an independent review in your 2011 manifesto. What's your take on this now?
My initial reaction when I started was to have commissioned an independent review of the whole social services department of the agency immediately. But I was discouraged from doing so by senior management, because I was told at the time, at the very, very beginning, that morale was so low and systems were not in place, that had we commissioned an independent review from someone in the UK, for example, that we would have failed, and that would have meant that the morale of the staff that was already very low would have been even worse. So therefore, in consultation with management of the care agency, I decided to defer that. And in place of that, what we've done is we've done our own internal reviews and our own looking at the way we work with a view to improving that. That's not to say that we are backtracking from our manifesto commitments at all. It's just that things are being done in a different way and in a different order, precisely because this is such a sensitive area and such an important issue that we have to make sure that we get it right, because the people to whom we provide this service deserve that we get it absolutely right.